Without a knock, I'll come in. Hello, I'm MC. I'll give you some privacy. I'm your RN today. How are you? Good, okay. Well, today we've got a few orders that we're gonna get going today. Okay, but first of all, I just wanted to see your band really fast. Okay, could you say your name? Okay, Mary Potter. Okay, your date of birth, 12/29/90. Okay, perfect. Okay, so for today, I have some doctor's orders to get that wound dressing in your chest, your central line, get it changed and get some blood drawn out. And I have lab with me here today as well, who will be assisting in getting those labs back with your name and everything on there, so we can get that going. Is that fine with you? Okay, perfect. Any allergies? No. Any pain right now? Okay, from 1 to 10, what do you rate that pain? A 6. Okay, well, we as well have some orders to give you some medication, and once I get there, I'll explain more about that. Sounds good, Mary? Okay, perfect. Okay, well, I'm just gonna do a little bit of some hand hygiene again. I'm gonna get my stuff ready. So for right now, I'll just raise you up. Okay, then I'll just lift your head just a tiny bit, okay? Just so I can have access to your chest, if that's okay. Okay, perfect. Bring this side rail down, okay? I'm gonna get my stuff a little bit closer, okay? Whoops. I'll get a new one of these. New of my syringes. So Mary, for this procedure today, I'm actually it's sterile, so I will need you to, I do have a mask for you, okay, which I will give to you, and I actually brought you a cool looking one. I brought you a little cow one, okay, and I'll have a mask on as well. So first of all, I'm just might as well put it on. Is that okay with you? Okay, perfect. So I'll get that on you. How does that feel? Good? Okay. So I'm just gonna get my mask on as well. Okay. I'm gonna get my bag ready. Okay, and I just ask for you just to not move at all, okay? During this whole procedure, let me know if anything is uncomfortable or it's not feeling okay. Okay, well, I'm gonna start taking it off. I would use my alcohol wipe, okay, just to peel it off in case if it's too sticky on your skin. We don't want to cause any damage to your skin. Still doing all right there, Mary? Okay. Yeah, this stuff sometimes they stick it on there like if they want you to keep it for life. Okay. Alrighty, and we'll just discard of that. Okay, now I'm just gonna take off these gloves. I'm gonna do some hand hygiene really fast. And just get my sterile fill ready, okay? So this is a procedure, I was telling you about that. We need to keep it as sterile as possible, okay? Yeah, I'm still here, Mary. I'm just trying to get this bag straightened out. Okay. Alrighty. And I'm just gonna take this out. Just lay it flat on here. Okay. And I'm gonna get my tweezers and alrighty, so let's get this going. I'm gonna switch this around, okay? Okay. I'm just gonna clean around. Get it very clean from the inside. And then we'll clean out on the outside. Get all that stuff very cleaned up, okay? And I'll dispose of that. And I have a Q-tip here, you know, just to get around the edges around here. Okay, perfect. Okay, we'll discard of that. I'll keep the tweezers just in case. Let me see. Actually, we'll be good without them. So now, I will now put your gauze, okay? Okay, there we go. Okay, and then I'll grab my sterile measuring tape. And I'm just gonna measure it just to make sure to document that the line hasn't been, you know, either moved out or moved in, and it's the right measurement to document in my findings and dispose of that. And then I'll grab this. Okay. Just gonna move this in closer. There we go. That looks much better, Mary. Okay. There we go. How did that go? Good? Yeah. Told you it'd be fast, Mary. Well, I didn't tell you, but. Let's see, maybe if I pull maybe this way around, it'll actually stick. Okay. Oh, look at that. If I thought it was going to go easy on the other side, it wasn't. Give me a second, Mary. There we go. Got it. Alrighty, and we'll dispose of that. Okay. Let me just take off these gloves really fast. And I would grab my pen and I would initial date. And then I'll put this on. Okay, there we go. Okay. So I just do some hand hygiene really fast and dispose of all my utensils. And get this out of the way, and then we'll go on to withdrawing that blood, okay? And that would be disposed in the garbage. Get some hand hygiene on. Okay. How's it going over there, Mary? Yeah, perfect. Okay. Okay, so I'm going to start off by unclamping. I'm going to take this one off. Okay. Take this cap off. I'm going to take this other port off. Okay, Mary, I'm just going to stick it with the cap I have up right here. So I'm just going to clean this off really fast with an alcohol wipe. Okay. Just going to open this. Be cautious without touching. And put it on there. Okay. Okay. Before, let me just put this on. And I will unclamp. And I will get some blood out of here. Okay. At least 5 to 7 of this blood, because this is old blood that lab will take with them. And then this will be the fresh blood that they need, at least up to 7 milliliters. Okay. Still doing fine, Mary? Yeah, okay. Okay. Okay, there we go. At least 7 milliliters, there we go. Okay, lab, will you please take this? Please initially get my patient's name, date, time, and then I will I will clamp this, and we will put on the new cap. Okay. Okay, and there we go. So, and then before let me just clean this up, and then we'll finish off with my saline, okay? Lab will take this away. Discard of that stuff. Okay, and then I'm just gonna infuse some saline in here, okay, Mary? And this procedure is done, so in case, you know, if there's any clots or anything, they don't get, so it can flush them. We don't want any blood clots, okay? And let me just tie this on here. I'll screw it on there. Okay, there we go. Let me unclamp this. And this is done slowly, barely tapping. You don't want to go fast. And you want to administer all 10 mLs. But it will be slowly. And all 10 have been administered. We don't want to go fast. Alrighty, there we go. Still doing good, Mary? Yeah, okay, awesome, sounds good. Well, I can take this mask off of you. Alrighty, and let me just dispose of all these. And we're gonna move on, and for doctor's orders, he wants some blood withdrawn, okay, and then we'll get an IV ready. Is that good for you? Yes, okay. Let's get that stuff started. Okay, so let me just get some gloves on. I have a fresh new pair of gloves for us. Okay, I'm going to move this out of the way for this procedure. Okay, Mary. So I'm just going to see your arm really fast. Okay. Okay. I will examine the arm to find the vein that I will be looking for to draw some blood. Just gonna raise your bed up just a little bit, okay? Maybe not that one. This one. Okay. Alrighty. Okay. Got one right here on the side. There's another one right here that's pretty good. Okay. I'm just gonna clean the site. Let it dry. Do you have a special vein that you like to use, Mary? No? Okay. I'm gonna use this side one over here. Is that okay? Okay, well you're gonna feel a little poke, okay? Here we go. So once I had enough blood, I would release, not yet, but I would take this out, get enough blood, put it over here, and get my gauze, red one, and stick it on there and pull out and clamp and dispose, and this would be taped on. Okay, clean that up and get that taped on. This will be labeled with the patient's name, date, time, initials, and put in the bag and sent to lab as soon as possible. Okay, Mary, now we're gonna start that IV. Is that okay with you? Okay, I'm just gonna I'll take these gloves off, hand hygiene and fresh new gloves. This is the only pair I've got left right now. Okay. Let me just get some of this stuff ready, Mary, okay? Okay, we'll wanna just get that right on there, okay, and flush. There we go. Okay, let me get my tape ready. So in the meanwhile, just getting your stuff ready, okay, Mary? Okay, there we go. So I'm just gonna put this tourniquet under your arm, okay, Mary? I'm gonna just move this gauze out of the way and dispose of it. Okay, can you lift up your arm? Okay, perfect, thank you. So I'm just gonna tie this around your arm, okay? If you feel uncomfortable or anything, just let me know, okay? Alrighty. So I'm just gonna feel. In this moment, I'm gonna take my gloves off, actually, to be able to feel. It's better to feel with your hands. These would be disposed and they're my new ones. And I'd feel around to see which vein felt pretty good. Okay, and then now that I've found one, I'm just gonna release this for right now. Okay, Mary? Okay, and I'm just gonna do some hand hygiene. I'm gonna put on my new gloves. Okay, I already found the site where I'm gonna go. And I'm just gonna pop and clean this. Okay, and dispose of that. My garbage is all over here, so that's the garbage. Let me bring it up close. Okay. Okay, let it dry. Well, I touched it again, so I'll grab a swab, clean it, let it dry. Okay, and now let's get things going. But now that I'm here, I need one of my needles, which I thought was in my bag, but it's not in my bag. So come and join me really fast to come and get a needle out of my bag. Okay, got my needle, switch gloves, you know, we want them to be clean. Okay, and then now we can proceed with our IV. Okay. Okay, you're gonna feel a little poke, okay? So at this moment, I'm waiting for blood flow back, which I would receive, and at that moment, I would put my hands here and retract. And I would grab my tube so I can be able to scroll this on, so I can put in the saline. Okay, and make sure it doesn't coil. And retract to see blood flow back into the syringe, and then proceed and administer all 10 mLs. Okay, now we would clamp. We do not want air bubbles in here. Rubber tape and tape it right under this incision. Okay. Okay, and then we will initial date, put right up on here, okay, and then we will just tape this across so it doesn't bother you, Mary. Still doing good? Yeah, okay, sounds good. Let me dispose of this, okay, dispose of this where the needles go. Okay, and this for my gloves. Okay, Mary, so at this time, I'm gonna get your medication and I'll be right back. So I would put her, of course, over the bed, down in position, comfortable position, and I would go into the nursing station and get my stuff ready. But for this instance, I'm right here, so I'm gonna keep this rail down. But I would grab my medication. I would do a check as I took the vial out of the med cart, and then another check before I'm leaving, before I'm coming into the patient's room, and the final check here at the bedside, which I want to make sure that it's morphine and that she needs 2 milligrams of it. I will, as well, the patient's rights, which is the right patient, the right medication, the right dose, the right route, the right time, and the right documentation. Mary, this medication is morphine. It is to help your pain. It can cause nausea, it can cause dizziness, it can cause sleepiness. If you feel anything different, just let me know, and we'll get it handled. Okay, Mary? Okay, perfect. Okay, so I'm just gonna put on my gloves. Before I take that out. And I clean it, let it dry. Okay, it's been dried. moving it slowly just so I don't get any air bubbles in here. It is IV medication, so we don't want any air bubbles. Just gonna get a little bit more. I would bring in a nurse. So when it came to discard any leftover medication, it is documented that it was discarded appropriately as it should be. I want to get this air bubble out. Just going to inject a little bit up. And making sure I still have my two. There we go. Okay. And I'll just move this. Okay. I will now unwrap this. Okay. Clean the swab, let it dry. Okay, and this medication does have to be administered slowly. And it is administered, I will unclamp, and it is supposed to be administered over 5 minutes, pushing slowly. I won't be here for 5 minutes, but it is administered slowly in those 5 minutes. Okay, and then once it's all administered, it will be clamped. Remove. I'm gonna get my saline. And flush it, and I will flush it as well very slowly. I'll unclamp and I will flush slowly because there is still medication in the line. Still feeling good, Mary? Yeah? Okay. Okay. Now I'll stop before, so there are no air bubbles get in that line, and I will clamp. Okay, and remove. Okay, Mary. Well, now that we got this all done, now it has been time that it is time to remove this IV. Is that okay with you? Okay, perfect. Well, I am now going to remove the tape around. I will grab my alcohol wipe just to not cause any skin breakdown, okay? And clean, 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 clean. Okay, let me throw that over there. Okay. Now I'll grab my gauze and I'm gonna pull on 1, 2, 3, okay? There we go. Okay. How's that feel? Good, okay. Any pain? No? Okay, perfect. Well, that's it right there. These were the doctor's orders for today. Is there any other questions you have, Mary? No? Okay. Well, I'll just clean up. Medication is disposed with another nurse, and it is documented as how it should be discarded, and that there was a witness that was there. That's all my garbage. Blood will be sent to labs. Okay, Mary, well, we are done for today. Let me just get some hand hygiene. Is there anything else I can do for you? No? Okay. You want to be covered up? Okay. It is kind of chilly out today. Okay, well, I'll lower your bed. Do you want your head up or down? Up? Is that good where you're at right now? Yeah? Okay, perfect. Sounds good. Okay, well, you have a great day. If you have any questions, let me know. Your call light is right here next to you. So if you need anything else, okay? Thank you. I cleaned up and documented and charted, and that's it. Thank you.